Emergency medicine is a specialty that evolved over the last several decades that involves stabilization and treatment of people with actual life or limb-threatening emergencies.
We get to see people who come in with little things like a cut on their hand, or we see people who come in with big things like a heart attack or a stroke, and we get to figure those things out and we get to fix those people. So emergency medicine is really being a jack of all trades and master of none, but we're really the master of seeing those people when they're first ill and injured and taking care of them in that first little time when they are really sick.
What's unique about Lone Peak is there won't be any other facilities like that in the valley. It will be a freestanding emergency department. The only difference is it's not connected to a hospital, but it will be staffed by the same physicians who work here at St. Mark's Hospital. So you've got a world of experience, and we'll be able to take care of most things there because we'll have the backup of CAT scans, MRI scans, lab tests. We'll have all capabilities. But most importantly, we've got the experience of a great St. Mark's ER team.
Construction is well underway here at St. Mark's Lone Peak Emergency Center with an expected opening date of May of 2010. What that means for the community of Draper is high quality emergency medical care with our 24 emergency medicine residency trained physicians with over 226 years of combined emergency medical experience.
Well, this is the St. Mark's Hospital Lone Peak Emergency Center. Behind me will be the central area where the nurses and the doctors work. This area to my right is the new ambulance entrance. This is where ambulances will bring the critically injured and ill patients. And then we can receive them here in a new trauma room, just like those at any other trauma center, as well as other treatment rooms that surround this central nursing staff station here. We have abilities here to take you to radiology and see with the most modern imaging, as well as psychiatric illnesses and other medical illnesses. For example, we can treat heart attacks and trauma victims. We can treat pediatric cases here as well as psychiatric cases. We can treat overdoses and injuries.
So the emergency room is important to a community in the aspect that we are, again, the front door to the community for emergency care 24/7, as opposed to your office, which may or may not be closed. And we're also kind of well known and intertwined with your primary care doctors and the specialists in the community, and therefore just a good first step for everybody in a community and well tied in.
We're finding now that time is important. We call it time is tissue. It refers to heart attacks, to strokes, to severe injuries. Whatever you do, sometimes the quicker you can get to the emergency department, the more likely you are to either save a life or salvage an important part of your body like your brain or your heart or a leg.
Urgent cares on the corner are helpful for minor injuries and illnesses. What this facility does is gives us the full spectrum of care from minor emergency as well as major illness and emergency care. So we can take care of the whole spectrum every day of the year, all night, and all day if necessary. And if any further care needs to be done, for example, inpatient care, we can facilitate that as well.
Urgent care facilities often send anything that is beyond their capabilities on to us in an emergency department setting where we have a higher level of training, more extensive capabilities as far as stabilization and treatment of truly life-threatening emergencies, such as heart attacks or blood clots in the lungs, or surgical emergencies of the abdomen, strokes or other neurological emergencies, or the need for admission to a hospital for stabilization and treatment.
The advent of the TV show ER, people are starting to realize that emergency medicine is indeed its own specialty. And through that training, board certification, we obtain the skills to actually take care of the true emergencies that can walk through our door, or of course come in by ambulance as well.
If you needed to be admitted to the hospital, you would go to the hospital. But most people who come to the emergency room don't get admitted to the hospital. They come, they get diagnosed, they get tests, they get treated, and they go home. So we feel that Lone Peak meets a need there in Draper where many of those people can receive all the emergency care that they need and never have to leave their community. The people who do have to be admitted to the hospital go to St. Mark's, which they already do. So I think that it'll be a huge benefit to the community in that they can receive their care in their community.